The program planned for evaluation is the Crisis Center of Tampa Bay. This nonprofit organization provides mental health and crisis intervention assistance in Central Florida. The evaluation program seeks to assess the effectiveness and impact of the Crisis Center's programs, identify areas for improvement, and demonstrate the values of its service to stakeholders. The center is located in Tampa, Florida, and it provides mental health and crisis intervention, including support for sexual or physical violence, domestic violence, depression, substance abuse, and other issues. The center operates in a 24/7 support for individuals in the crisis. Some notable expenses include $650,000 for executive compensation and $10.5 million for salaries and wages. A program revenue summary includes contributions being at about 63% of the budget, program services about 37%, and other revenues 0.6%. The center has about 210 employees and a variable number of volunteers depending on the season. The leadership group includes the president and CEO Clara Reynolds, Client Services VP Sandra Hall, Jennifer Moore as the Development VP, and Katie Androff as the Talent Management. The CFO is Susan Leonard. The purpose of the evaluation for the Crisis Center of Tampa Bay is to assess its program's effectiveness and impact systematically. This is to determine how well the Crisis Center programs meet their goals and objectives, evaluate the quality and outcomes of the services provided to individuals. Areas for improvement include highlighting strengths and pinpoint areas where the program can be enhanced, provide actionable recommendations to improve service delivery and client outcomes. A way to demonstrate value to the stakeholders includes showing the impact and value of the Crisis Center services to funders, donors, and the community by using data to support the organization's mission and justify the continued or increased funding. Support to continuous improvement includes using the evaluation findings to refine and enhance programs over time. By conducting this evaluation, the Crisis Center aims to strengthen its ability to support individuals in crisis, promote mental health, and deliver compassionate care. The evaluation will provide a structured approach to understanding the impact of its services and ensuring they are as effective and efficient as possible. Stakeholders and the ESW team. Internal stakeholders include the President and CEO Clara Reynolds, whose priorities include overall program effectiveness, strategic outcomes, and community impact. Sandra Hall, the VP of Client Services, will work on client satisfaction, service delivery efficiency, and program outcomes. Jennifer Moore, the VP of Development, will focus on fundraising effectiveness, donor engagement, and financial stability. Talent Management, run by Katie Androff, will prioritize staff performance, training effectiveness, and volunteer engagement. Susan Leonard, who is the CFO, will work on financial performance, budget adherence, and cost effectiveness. Josh Kwasicki, the Director of Organizational Development, will work on organizational growth, process improvements, and accreditation standards. Dasha Oglesby, who is the PQI and Compliance Manager, will prioritize compliance with standards, quality improvement, and metric risks management. The Board of Directors will work on strategic alignment, governance effectiveness, and overall organizational impact. The external stakeholders are the City of Tampa, which provides detailed information about the Crisis Center services, community impact, and partnership, as well as the Community Foundation of Tampa Bay, which supports local nonprofits, including the Crisis Center, with funding and community initiatives. The ESW team will likely include representatives from the internal stakeholders listed above, particularly those in leadership roles such as Clara Reynolds, Sandra Hall, Jennifer Moore, Katie Androff, Susan Leonard, Josh Kwasicki, and Dasha Oglesby. This team will be responsible for guiding the evaluation process, ensuring that it addresses the key information needs of the organization, and facilitating communication between internal and external stakeholders. The logic model for the Crisis Center illustrates how the organization utilizes its resources to conduct various activities that produce measurable outputs. These outputs lead to short-term and intermediate outcomes, ultimately contributing to long-term impact such as reduced crisis incidents and improved community well-being. This model helps stakeholders understand the connection between the crisis center's efforts and its mission to provide compassionate care and support for those in the crisis. Data sources include the Community Foundation of Tampa Bay, which provides credible foundation provide data on the funding and community initiatives, as well as internal organization data, which provides accurate financial records, reporting, and feedback. Barriers and solutions include data accessibility. This will improve data sharing agreements and internal management. Resource constraints, prioritizing key evaluation questions and seek additional funding. Biases, using multiple data sources and systematic analysis methods. Stakeholders engagement, developing actionable recommendations and follow-up plans. By addressing these barriers, the Crisis Center can ensure a robust evaluation process that enhances its support for individuals in crisis and promotes community well-being. Methods grid. Surveys, interviews, and program records were analyzed using descriptive and thematic statistics. Surveys focus groups were analyzed using factor analysis and qualitative coding. Patient outcome records, partnership reports, analyzed using comparable and regression analysis. Crime statistics, intervention reports were analyzed using trends and correlation analysis. Long-term community outcomes include surveys and health assessments for impact assessments. ESW member responsibilities include overseeing evaluation that is aligned with strategic goals, facilitating client service and implementing service improvements, analyzing fundraising data to enhance strategies, collecting staff performance data and overseeing volunteer surveys, providing financial data to ensure budget adherence, supporting data collection on growth and improvements, and ensuring compliance and managing quality metrics. Hypothesized answers to evaluation questions include effectively addressed with positive outcomes and high satisfaction, driven by counseling quality, service accessibility, and staff professionalism, improved through integrated care and timely referrals, as well as enhanced by reducing repeat incidents through crisis support, and improved community well-being and resilience with fewer crises and more support networks. The communication plan table and tracking chart ensure effective dissemination of evaluation results to stakeholders. The purpose is to communicate evaluation results effectively. Key individuals involved in or affected by the programs and tailored to the information and stakeholder preferences. Email for documentation, meeting for discussions include communication channels. The communication tracking chart is to ensure timely updates and meets communication objectives. The justification includes stakeholders influencing program outcomes and decisions suitable for the information type and stakeholder needs. And this also provides timely updates for informed decision making. This structured approach leads to better program outcomes and enhanced community well-being. The Crisis Center is a well-regarded organization dedicated to ensuring that no one in the community has to face a crisis alone. Here are some key points to consider when evaluating their programs and organization. They offer trauma counseling, sexual assault services, suicide prevention, and veteran support. Another strength is their response to over 170,000 requests annually, including fully independent board and ensures an unbiased decision making. Some areas for improvement include needing to increase awareness and outreach efforts, as well as they could enhance volunteer programs and engagement. The planned evaluation of the Crisis Center aims to enhance program effectiveness, inform decision-making, increase accountability, improve resource allocation, strengthen community engagement, support sustainable growth, and enhance volunteer and staff engagement. These outcomes will help the organization better serve individuals in crisis and fulfill its mission of providing compassionate care to the community.